Hi, this is Chris Westfall. Today I got an interesting question from an agent who's been an agent for a long time and was presented by a senior who was 72 years old, and she had never joined a Part D drug plan. And so she was very sad to find out, and she educated the agent that there is a penalty for not getting a drug plan when you first turn 65. There is something that everybody should know that's in the Medicare space, especially the agents that are helping seniors with their Medicare plans, and that is, if you're dealing with an agent who is trying to help you when you're turning 65 and they don't know all the aspects of what you need to look out for, because if you don't know that information, it can penalize you for the rest of your life, you need to consider strongly who you're doing business with. And as an agent, I would tell you, if you've not yet at least read the Medicare and You guidebook, which is the Bible for all things Medicare, on which to build your education pyramid of what you need to know in this business, then you need to stop giving advice on anything having to do with Medicare. Go back to the basics and read the Medicare and You guidebook. Okay, that's enough preaching for now. So let's cover in detail what is the late penalty for not signing up for Part D. When you turn 65, you've got that initial election period, that open enrollment period where you can sign up for any plan, any Medicare supplement plan or Medicare Advantage plan or Part D drug plan without respect to any kind of health problems that you've got. You can do that 3 months before, 3 months after, including basically it's within the first 6 months of turning 65, okay? If you don't do that, or if any time after that you don't want a Part D drug plan, that's your right. You don't have to get the drug plan, but if you don't, you just need to understand you're going to pay a 1% per month penalty for the rest of your life when you do suddenly decide later on that you do want a Part D drug plan. And worse, you have to wait until January of the next year to get on a plan if you opted otherwise not to have one. So on Medicare.gov, they've got this penalty broken down, and it kind of explains the way it works. One misconception is that the cheapest plan in the marketplace, which is generally, as of the recording date of this video, it's Humana's Part D drug plan, the Humana-Walmart partnership. It's very inexpensive. It's around $16 a month. Cheapest one in the country. In the future, that may be changed, but it's important to know that many people think that hearing that there's a 1% penalty added to their monthly premium, it means that that's going to be based on their monthly premium. It's not. It's based on the national base beneficiary premium, which in 2015 is $33 a month. See, that's an average of all the premiums in the country. Right in the middle, that's the average of the premium. So that's what the penalty is based on. So you could quite literally sign up for the Humana Walmart plan at $15.70 per month and then suddenly find that you're paying $28 a month for that cheap plan. Why is that? It's because for every month that you sat out and you had the opportunity to have a Part D drug plan and you chose not to, you will be assessed a penalty of 1% per month, and that's for the rest of your life. So sit out for 60 months, that's 5 years, and that's a 60% per month penalty. And again, that 60% is based on the national average premium. So that could hurt quite a bit. And some examples are given on the Medicare and You site there. This example here, let me zoom in. So you have a lady who, since 2014, she was without credible prescription coverage, so she had no coverage, from June 2011 to December 2013. So her penalty was 31%. Again, 1% per month for those 31 months that she sat out, or $10.05 per month. Since the penalty is always rounded to the nearest 10 cents, she paid $10.10 each month in addition to her plan's monthly premium in 2014. And that's every month for the rest of your life. So her late enrollment penalty will be $10 per month for the rest of her life. So if you want to dispute that, you can. It's not a cut and dry thing. You can dispute it, especially if you had comparable coverage or creditable coverage through an employer plan for much of that time since you were 65. But the burden of proof is on you, and you've got to get with Medicare to get them to consider relief as far as that goes. But I'll tell you this, you need to really factor in the penalty when you're deciding whether or not to get a Part D drug plan when you're turning 65. It's a big decision. And one of the things we often counsel seniors who are kind of resistant to this government mandated regulation that you have Part D drug plan or else pay the penalty is get the least expensive plan. If your alternative is to get no plan at all, at least get the least expensive plan in the marketplace. So you've got what I call a placeholder plan, something that's just holding your place, it's creditable coverage, and later on if you need to upgrade to a more comprehensive plan, remember with the Part D drug plans, every year during the annual election period, you can make a new choice. Now that new choice will kick in on January of the next year, but you always need to revisit that option every year. Look at your list of drugs. Don't assume by any means that the drug plan you had last year will also be the best drug plan for next year. No, you always need to go over those drug plans. I'm going to tell you a little secret here. If you call Medicare at night, preferably the later at night the better. If you call Medicare late at night, and I'll put the number here on the screen, they will go over your drugs with you and help you pick a drug plan, and they can sign you up for that drug plan. This is the same whether you're turning 65 now or it's the annual election period and you're getting a plan for the next year. That what they'll do is they'll go through the Medicare.gov prescription plan finder, which you can do online by simply entering in your drugs, and we do that for our clients. But you can do this very easily over the phone with Medicare late at night when nobody else in the country even knows that they're working. See, they work 24 hours a day for you. So utilize that service. They're very friendly. They will help you pick the best drug plan based on your particular drugs. It's often a mistake that people will sign up for the cheapest drug plan out there without any regard to what drugs they are taking. If you're taking expensive brand name drugs, then I can assure you that the cheapest premium plan in the market is not going to be right for you. You could sign up for a $16 a month premium plan and ultimately be paying thousands of dollars per month more than you should because you got signed up with the wrong plan. So that placeholder plan I was telling you about, the very inexpensive plan, is generally only best if you're taking not any drugs at all or just a few generic drugs. Anything beyond that, you need to compare your drug cabinet formulary with what's available with the drug plans in the market. You do that when you're turning 65, and again, you need to revisit that every fall before the annual election period ends, usually December 7th every year. My name is Chris Westfall. If I can help you with anything else, if you're a senior client, you can go to seniorsavingsnetwork.org. If you're an agent selling Medicare, you can join us at medicareagenttraining.com. Thanks for watching.